These are ways neurosurgeons can drain fluid from your brain and relieve pressure. The first place is called Coker's Point, and this is by far the most common place to place a drain into the brain. You measure 11 centimeters behind the nasion and 2.5 centimeters off the midline. Then you're placing the drain through a hole in the skull. Next three are from the back. They're called Frasers' point, Dandy's point, and Sanchez's point. This is Frasers' point. It's 6 centimeters above the inion and 3 centimeters off midline. Dandy's point is similar. It's just a little bit lower, but still aiming for the occipital horn. This is Sanchez's point. It's again posterior, but it's aiming for the temporal horn. Very useful if you have an entrapped temporal horn. But don't forget about Keen's point. You're measuring off the ear to make sure you can aim for the lateral ventricle. The next one is called Payne's point, and it's here in purple. You do this after you've already done a craniotomy, which means you've taken off the bone. There's been some modifications to Payne's point, so that way you're adjusting the trajectory so you're not hurting the part of the brain responsible for speech. We're moving to the front of the head. This is called Kaufman's point. You really want to avoid this because you're going to leave a big scar in front of the forehead. The next ones might make you a little queasy if you're not a neurosurgeon, so you might want to stop here. But otherwise, here's the next one. This is called Tubbs point, and yes, you're going to the eye. I've never seen this performed because you have so many other options, but you could perform it if you didn't have a drill and you just needed to put a needle into the part of the brain with fluid. The last one is called Minovsky's point. You use this drain when you're doing a surgery through the eyebrow. Some of these may look scary, which is why you want your neurosurgeon to be well trained.